What does this course include? Well, ECCO is just full of features. The course is designed with 18 modules in the ICU track and 17 modules in the PCU track. Each module has a variety of assignments, usually 3 to 7 per module. And the assignments are tracked in the learning management system. What does that mean? Well, that means for educators, it really allows for flexible learning and the ability to tell their nurses which assignments they'd like them to complete first and which assignments might make more sense to do later. But it gives that flexibility in tracking and then allows for a flexibility in assigning the content. We also want you to know that ECCO has been designed and reviewed regularly, and it is updated very consistently and at very regular intervals with the latest evidence-based content. What does that mean for the educator? Well, it means that you don't have to keep your critical care class up to date because ECCO is always up to date. And we use more than 300 nurse reviewers in that process of keeping the content up to date and current to what your practice is in your ICU or your PCU. If you're thinking about taking ECCO or you're thinking about applying it for your nurses who are in orientation, you might ask the question, how should they complete it? Should you complete all 18 modules? And in what time frame would that make sense? I'll get into more of the weeds in this with the educators in the section on implementation and best practices. But what I want you to know is that ECCO is so flexible that you can pick and choose what is most applicable to your learning needs at this time and start that content, and then you can finish the other content later. Or as I mentioned, if you're an individual looking at self-study, you can actually just purchase individual modules. Educators can do that as well. If there's just a learner who needs maybe one module, it has the ability to just have that one module be purchased. So you can choose what order to complete the assignments. I will give you some fair warning though. We use a lot of case studies in ECCO, and some of those assignment case studies overlap, meaning that might start in assignment 1 and then it continues back up in assignment 3. So if you started with assignment 3, you'll get a recap of where the patient has been prior, but you won't see the full picture of what they might have covered in assignment 1. So it might make sense to complete them in order. But as I said, ECCO is so flexible. So you can just decide what you want to do first or how you want your learners to approach the content so that they get what they need when they need it. It's the ultimate in just-in-time learning. So what do I mean by flexible learning? Well, let me give you an example. You're going to complete the assignments that are relevant to your current needs first, and then go back and finish other assignments as part of your ongoing orientation. So let me give you an example. Cardiovascular 1 in Module 1 has 5 assignments. And in Cardiovascular 1, the first 3 assignments are assessing, diagnosing acute coronary syndrome, and treating acute coronary syndrome. And it covers ST elevation MI, non-ST elevation MI, and unstable angina. The last 2 assignments are about complications as well as procedures. So when you think about your learning needs and you're coming into ICU, you definitely need to know about assessing the cardiovascular system. And you also want to learn about how to treat and diagnose an acute MI or a STEMI or a non-STEMI. And then once you have that content really solid, then you can go back and learn about the complications and learn more about how to assess and manage pulmonary edema, right ventricular MI, cardiogenic shock, as well as other complications. And then the last assignment, non-invasive and invasive cardiac procedures, everybody should probably know a little bit about those because you may have to do patient teaching. But if you aren't actually working with pre and post cardiac procedures, you probably don't need all the detail. So you could skip those portions of that assignment and just do the pieces that you need to help with teaching. Unless, of course, you're working with those types of patients, and then you'd want to complete all of the content. So I hope by this example, you can see how flexible the content in ECCO is to your learning needs and what your learners as an educator might need. In summary, I just want you to know that we are here to help you with ECCO, whatever you need. If we can help you implement it, if we can help you decide if it's what you need for you to continue your self-study and your learning, we're here. Please contact us at info@aacn.org. My name again is Julie Miller, and I've been pleased to present this content for you today. Have a good day.